asked the rightful question, what's been going on for several years, especially when the Republicans control the White House and both houses of Congress for 6 years? What measures have been taken to make health care more affordable and more accessible to more Americans? I chaired the House Small Business Committee for 6 years. We held hearings across the country on affordability of health insurance for Americans and the impact of medical liability suits on the medical profession. In fact, we held 12 hearings on medical liability insurance. Here are some of the things that we've been working on. Is to allow the creation of association health plans so that small employers like my brother Frankie, he's back there, could join together with like employers across the nation so that small employers would not be burdened with such things as pre-existing illnesses or affordability. And small business people could have the purchasing power of large unions and large corporations. Twice we passed that in the House of Representatives, it went on to the Senate, and it died by 2 votes. That bill alone would have put insurance within the hands of probably half the people in this country that don't have insurance. Second, we worked on expanding tax-free availability of health savings accounts. How many here have HSAs, health savings accounts? Okay. Health savings accounts take pre-tax dollars. They allow employers to get a high deductible. They allow the insured to be consumers. We've seen cases of businesses as small as 4 and 5 employees where it's chopped the cost of health and accident insurance to the employer by 1/3 to 1/2. We wanted to expand this. Unfortunately, in the base bill, H.R. 3200, they'd be wiped out. Expanded small business tax deduction for health care expenses. Today we have what I consider a miserable state taking place with regard to mom and pop run businesses. They have to buy health and accident insurance with after payroll taxes. They should be allowed to purchase health and accident insurance with pre-payroll tax dollars that automatically reduces the cost of health and accident insurance to little guys by 15.6%. Creating refundable tax credits to help low-income Americans purchase health insurance. Instead of people paying income tax, give them the option to buy health insurance. Guess where they're going to spend their money? That's the better option because it covers more people. And instead of taking their income tax and creating 53 new governments and agencies, they use that very money they use for taxes to buy health care insurance. Preserving high-quality health care through America's community health system. We support continued funding for community health clinics, which provide high-quality health care to America's low-income families. We've been a strong supporter of Rockford Crusader Clinic. We've served more than 40,000 people. Gordy, ever stand up? The director of the Crusader Clinic in Rockford served 40,000 people. Later on, just take a few minutes to explain to you what the Crusader Clinic is doing, and President Bush enlarging clinics such as Crusader Clinic by 60%. Reforming our out-of-control medical liability system. You cannot have health care reform unless we do something about the assault that our surgeons and our hospitals are under with regard to the lawsuits that are taking place. We obviously need a remedy for people that have been injured, and rightly so, and reasonable compensation. When we held these hearings across the country, we were in one I think it was in Zoc. It was in the suburbs of Chicago. It's been several years ago. There were 3 ladies, 3 OBGYNs, who practiced together. Their medical liability insurance was $450,000 a year. The senior partner of that firm made less than the general manager of that particular clinic. And she said, Congressman, she said, don't people understand that we can only pay so much in medical liability insurance and then we have to leave the profession? She said, in fact, I'm preparing to leave. Today she works at her former profession as a pharmacist at a Walgreens in the suburbs. You won't see the statistics of the people that have had to leave the practice of medicine because of the high cost of medical liability insurance. Every time they pay a big premium, guess who ends paying it? We do. it gets passed directly on to us. In fact, we passed legislation on a bipartisan basis to do away with the ridiculous genetic screening that some insurance and some employers wanted, so that when a person goes to get insurance or to be employed, no one could never ask again for a genetic screen that would exclude them automatically. We can create incentives to save now for future long-term health care needs by creating new tax benefits to offset the cost of long-term care premiums. For those people that are running into a max of $1 million or so, we can create a high-risk pool for those who are maxing out on the $1 million caps on health insurance. It's not hard to do. These are done all the time, and it doesn't cost that much. There are other things that we can do. No one's talking about wellness. As I drink this water, I don't know where it comes from. But there's very little talk about wellness. There it is. Probably is. I can say that now because I now have an online Weight Watchers partner in my chat room, so the two of us can support each other in trying to lose weight. Okay? But the only way to bend the cost curve is to have less sick people. It's astonishing how much we can lower the cost of health care by taking personal responsibility over our lives. 50% of cancers may be avoided or mitigated through diet and lifestyle. 80% of heart diseases can be avoided by diet and exercise, and a huge percentage of diabetes can be avoided by proper diet and weight loss. Illinois, I think, was the first state in the nation that imposed mandatory physical education in the school system. We do some things right in this state. But that's what we have to talk about is wellness. It's giving incentives to employers to be able for every employer to open up a shop for physical activity, to be able to bring in people who are nutritionists and weight counselors. But this may sound kind of silly and trite, but if we exercise individual responsibility in our own diets and taking care of ourselves, we can not only lengthen the years of lives that we live, but lessen the burden on the rest of Americans. But being a person who does not believe in big government and individual responsibility, I've got to lead the way for you, so you're going to have to help me on this diet, okay?